So I had a good question the other day is, what is the Shockwave good for? And that's what I have on my hand. Today we're just going to go deep dive into a topic that just might ruffle a few feathers. The idea that Shockwave therapy is not a magic wand. That's right. This beloved tool that you see on Instagram will not solve any or all of the world's musculoskeletal problems. Shocking, I know. So Shockwave therapy is contraindicated in 4 main scenarios. Basically, you do not want to use it in these 4 spots. Growth plates in kids. If you apply it to growth plates, you want to avoid them because they're fragile. Despite some studies that you could use them low energy, they say it might not cause damage. The standard care for kids still remains rest and load modification. Where you don't want to use it, number 2, active infections or tumors. Shockwave therapy is basically not recommended as it may inadvertently stimulate harmful processes. Third, you do not want to use this in clotting disorders or anticoagulation therapy or someone who's on blood thinners. They're at risk for bleeding. Complications during treatment can occur. Lastly, you do not want to use it with someone who has vascular or nerve disorders. Due to concerns with tissue vulnerability, although there are some evolving research out there saying that there are some potential benefits in carefully selected patients. Now, where do we want to use this? An expert consensus of data in sports medicine and musculoskeletal care states that it's recommended for a wide chronic range of conditions: chronic tendon, bone stress, selected soft tissue conditions. The agreement rates have always been consistently 85 to 100% across expert panels. Now, one of the most substantial support actually exists for chronic tendinopathies. It could include plantar fascia, Achilles tendon, like common, or say extensor and medial epicondyle areas, like these areas here, hamstring tendon, glutes. The endorsement has been about 100% among expert panels. Now, Shockwave therapy is also supported for shoulder, calcific rotator cuff tendinopathy, greater trochanteric pain right around the hip on the outside. If you have some sort of partial tear, if the symptoms are persistent and conservative care alone has failed, this would be a good option. Now, across these conditions, this isn't necessarily a standalone cure. It's an effective tool if you mix it. Its role, it has a high value intervention if you apply it to the right condition, right stage of healing, and then you combine it with appropriate rehab and load management. So Shockwave therapy is powerful, as you can see, but its effectiveness is amplified if you combine it with manual therapy, exercise, and thoughtful modification. Now, bottom line, what's the takeaway? So we always emphasize clinical success is rarely about one best treatment, but it's about identifying the right recipe for interventions, and then you tailor it to each unique patient presentation.